We are going to be talking about public health vending from conceptualization to implementation today. So in this presentation, we're going to cover Southern Nevada's current harm reduction efforts. We're also going to go in depth on the vending machine project, including conceptualization of the project, successes we've achieved, as well as lessons that we've learned along the way during the implementation process. We will be available for questions at the end of the presentation as well. Okay, so I'm just going to give you a brief overview of Track B Exchange and our harm reduction programs. So Track B Exchange offers harm reduction products. We offer education as well as linkage to care and testing services in a variety of ways. So the main way that we offer harm reduction is through our storefront. The storefront syringe access program was the first program that we opened. The storefront is open 6 days a week and has been a great way for us to meet clients face to face, and also to provide them with education on all of the products that we offer harm reduction services as well. We have a shipping program. We were lucky enough to be given a grant through the state of Nevada's Division of Public and Behavioral Health back in 2018. That grant allowed us to provide harm reduction products to clients throughout the state of Nevada. The shipping grant allowed us to ship syringes to our rural and frontier counties. And that was something that we kind of kept going and expanded during the COVID-19 pandemic because we were able to ship syringes and harm reduction supplies directly to our clients in order to lessen the number of people coming to the storefront program. We have our mobile outreach, which we do mobile distribution. It's done by our outreach team here a few times a week. The team travels to community events, tunnels, encampments, houses, just any locations where they can meet clients face to face and they're able to provide supplies directly to clients. We do HIV testing and education as well. Our mobile outreach also includes our mobile medication assisted treatment team that travels throughout the state to provide medication, prescriptions, substance use disorder assessments, counseling for treatment of opioid use disorder. We have our wellness clinic that's recently opened. It's in a convenient location right around the corner from our current storefront. It's run by our wonderful nurse practitioner, Cheryl, who's able to prescribe medications to treat opioid use disorder. It's also a full service clinic. We have our peer services, our peer recovery support services are run by our peer specialists. They respond to opioid related incidents in local emergency rooms. And we are getting ready to expand that to have peers in 2 emergency rooms 24 hours a day. And then we also have a really informal secondary exchange where we are able to provide people with syringes to give out to others. And then our service that we're talking about today is vending. So I'm going to just dive a little bit deeper into that. Okay, so this is just kind of a timeline of public health vending in the history in the state of Nevada. Starting in April 2007, we did some formative research on syringe service programs, as well as vending machines. That was started at the Southern Nevada Health District, which is our local health department. And it was led by Rick Reich, who was then the manager of the HIV program at the health district. And he's now our director here at Track B Exchange. And then also that was led by Marlo Tanj, who's the current Office of Epidemiology and Disease Surveillance Manager at the health district. In 2012, we started analysis on the utility of vending machines in non-traditional venues, and that included researching vending machines that are used around the world for syringe distribution as well as condom distribution. In 2016, we had some final plans created to open Track B Exchange, the storefront, and then also the first machines were purchased. In 2017, the storefront opened on February 1st, and that was the first harm reduction program in Southern Nevada. 3 months later, Track B Exchange implemented Impact Exchange, and we rolled out the first 3 vending machines in Clark County. And then last year, October 23rd, Track B opened the first vending machine that was outside of Clark County, which is in Hawthorne, Nevada, which is a rural community about 5 hours north of Las Vegas. So this slide is just showing some of the benefits of syringe vending. We actually call it public health vending usually because of the different supplies that we're able to place in the machines. So the units are standalone units. They look really similar to a soda vending machine, but they dispense sterile syringes. The reasons that we kind of chose to do this model, and the reason why, you know, vending was really an appealing thing for us is vending is just a new way to tackle an old problem. We were able to increase HIV and STD testing, deliver materials needed to keep people safe, and also increase access to hard to reach populations to get syringe exchange as well as other harm reduction related information and supplies. We always knew that one storefront wouldn't be enough to serve the entire community. So vending machines allow us to expand our services with fewer associated costs compared to opening multiple brick and mortar locations. So we are able to provide these in communities that are under-resourced and in need of services in order to help them receive these services at a much lower cost. Vending allows us to partner with like-minded and like-missioned agencies. So mental health, drug and alcohol treatment providers, homeless coalitions, we're able to work with them and place these vending machines in buildings that they already are using. Because we want providers to be able to expand their harm reduction reach to their current clients. We hope that vending machines will reach people in communities that may be resistant to services, especially our unsheltered homeless population. We hope that vending machines are going to help to reduce stigma, because we always say that vending machines don't have the ability to have a stigma, so people can really feel comfortable getting their supplies from a vending machine without feeling that someone's going to judge them or really have anything to say. It can also allow people to discreetly access all these supplies. And finally, syringe vending machines help to reach non-traditional populations, like those in suburban areas, rural areas, and other areas that may not have had access to services that are often offered in urban areas. Right. So we're going to talk about just public health vending and the locations that we currently have. So currently we're operating in 8 sites. 7 of them, are here in Clark County, and 1 of them is in rural Nevada in Hawthorne. Location selection has been really important to this project. Usually we have partners in the community that are reaching out to us that want one of these vending machines. So currently we have 3 machines that are located with addiction treatment centers. 2 are in centers for behavioral health locations, which have actually had some really good success with these vending machines. They've had over 60 clients that have used the vending machines actually get into treatment in their medication-assisted treatment programs. And then we also have 1 in a New Mind, which is another medication-assisted treatment center located here in Las Vegas. We have them in community centers. Community centers are great places to place machines because they often offer a multitude of services. We have 1 at the center, which is our local gay and lesbian center, which is a great location for us because it offers HIV and STD screening, as well as peer recovery support services. We have 2 machines located in primary care clinics, Hunt Ridge Family Clinic, as well as Tim Care. And then private businesses, we have a machine located at Entourage Men's Spa, so you can really choose some really non-traditional locations for these vending machines. And then of course we have our outdoor location, which is in Hawthorne, Nevada. The photo that you see there of the vending machine that's located outdoors, the coalition in Hawthorne had built a shelter for the machine so that it's able to be outside and it can kind of withstand the changes in weather. Some of our past sites that we've used were an HIV advocacy and counseling center, as well as in the past we did have a machine in our Track B storefront when we first rolled out the program, in order to make sure that if there was press or anybody who just wanted to come and see the machine, they were able to just come to the storefront and not bother any of our community partners. All right, so some of the products that we place in the machines are shown here on this slide. So we have syringe kits. Currently the syringe kits have 30 syringes in each kit, and they come in 2 different sizes. So we have the short needles and the long needles, as well as cotton filters, sterile water, cookers, tourniquets, Band-Aids. We also have a sharps container in each of those kits so that people have a safe place to store all of their used syringes. We have a business card so that clients can call us if they ever need any assistance. we usually place one flyer for a mat treatment center or another treatment center in the kits so that people have that information if they're interested. And then we also have a card that has the syringe service law here in Nevada, so that if people are ever stopped by the police, they actually have that card that they can show the police that has the law written on it. And we have safe sex kits that have condoms and lube, wound care kits that are, typical iodine and antiseptic wipes, Band-Aids, Tegaderm film. We have sharps container kits that only contain extra sharps containers in them if people have lots of syringes that they need to return to the sharps container, the disposal bins. We have fentanyl test strips, emergency contraception, the morning after pill. So really the sky's the limit on what you can place in these machines. We've heard ideas from other groups that are looking to get these machines that include COVID testing and just lots of other things. These machines are medical grade, so they were actually designed to be placed in hospitals and used by medical personnel. So you can really use them for anything. And we're really open to hearing about, other additional services that people are going to consider putting in their vending machines when they roll their machines out in their communities. Okay, so for sign up, we require some form of identification for sign up. It doesn't have to be government issued ID. It could be, as simple as a Facebook page or just something with someone's name on it. The only reason that we require that is to help prevent someone else from accessing someone's vending ID number if they call to try to get the vending ID number. Let's say they say their card was missing. And it also prevents people from getting multiple accounts and then just going to the machine on a regular basis and just draining the machine and not allowing other people to get supplies. Clients will fill out in a form. It's just basic demographics. It asks about needs for services and then some information on current practices. They receive a swipe card to access the machine. It's just a magnetic swipe card that has their unique ID embedded into it so that they can access the machine. We also write down their vending machine ID number on a card so that they can just enter it into the machine if they need to. Items in the machine are pre-programmed so that they only vend at certain amounts at certain times. Right now, we're limiting our syringe kits, which can contain 30 syringes, to once per week. Our naloxone kits are kind of on the same limit. That way, we can make sure that we have enough supplies for everybody. And then now we also have our online sign-up system that was developed for us by the Southern Nevada Health District. That way, people can actually sign up online and get a vending ID number while they're at the machine and they're able to use the machine. So one of the questions that we get asked a lot is data management. We're really lucky that these machines come built in with Vendovation, which manages transactions. Once a swipe card has been activated, we put their unique identifier into the Vendovation data management system. This allows us to activate their unique ID within the system and manage transactions within the vending machine, as well as it communicates about inventory. So we always know when a machine is running low on inventory. And we're able to generate utilization reports so that it's really easy for us to know how often people are using the machines and how many products are going out. So with each of these machines, we place a sharps container next to the machine. We want to make it as easy as possible for people to be able to dispose of all of their used sharps. In Southern Nevada, our staff uses the Sterilist machine, which you can see in the picture. It's an autoclave that will autoclave all of the used syringes while they're in their sharps containers. And then the bottom drops out and it has grinders. It'll shred those syringes into like that confetti type material you can see in the photo. And that just results in a non-biohazard material that can be safely disposed of in regular trash. That's really helped us out a lot with cost savings. And then I wanted to just present a little bit about our utilization data. So I pulled data from April 1st, 2017, which is when these machines rolled out, all the way to February 21st of this year. We have 2,953 unique clients that are signed up to use the vending machines. We've had over 25,000 vending transactions since these machines rolled out. We've given out almost 400,000 syringes at the machines. 3,800 naloxone kits have been given out at the machines, 766 pregnancy tests, as well as almost 2,000 safe sex kits. So they're definitely really popular machines and they're being used a lot. Sorry, I just went back a slide. All right, now I'm going to turn it over to Jessica.
Thanks so much, Chelsi. Great overview. I am planning to just kind of highlight some successes, lessons learned, and hopefully leave some time for questions. So I first wanted to highlight that one of the biggest strengths of this program in mine and Chelsi's discussion has been our partnership between the Southern Nevada Health District, the local health department, and Track B Exchange. I think this was mentioned briefly at the end of the morning discussion about the power of this partnership. And Chelsi and I brainstormed the list that you see here on the screen. I imagine that it's longer on both accounts, but really we try to look to lean into the strengths of each agency. So TrackB does an impeccable job at community buy-in from the community we serve, at service delivery to clients who use or inject drugs, on coordinating the on-site vending implementation and really the whole ongoing supply chain, and in the day-to-day operations, including the stocking of the vending machine and troubleshooting mechanical issues. In this role, the health district really serves as somewhat of a backbone organization in this work. So seeking support for Track B's efforts with sustainable funding opportunities and other areas, building the community capacity at the provider level across Las Vegas, and kind of bringing, I feel like Track B is fantastic about bringing us to the table in instances, and we work to bring them to the table, making sure everyone has a seat. And then really working together to develop evaluation tools and protocols and supporting data management systems. Next slide, Chels. There we go. So additional program successes over since 2017 are expanding from the initial 3 machines to a total of 8 vending machines. A modification to the product packaging that helped to that reduced cost, which I thought was really brilliant on Track B's part. The addition of emergency contraception and HIV testing, self-collected testing into the machines. The creation of an online sign-up system, which we're really proud of, and in the process of piloting at Track B storefront. The first outdoor and 24-hour vending machine location, as Chelsi mentioned, and then providing technical assistance to over 20 jurisdictions in the US. And Chelsi and I hosted a webinar last summer in August. A recording of that's available if anyone's interested, with over 200 attendees with an international audience, which we were really excited about. Next slide, Chels. Some lessons learned thus far, and looking forward to discussing these with folks in our comment period, but really assessing the community readiness prior to implementation has proved most successful, particularly in our rural communities. We had an early example of one of the rural communities in Nevada with some level of readiness. But in order to get placement for the machine, the funders asked that we get a letter of support from like the local, either city, county board, etc. So as we moved in that direction, what we learned was that there was an informal local board that we most likely should have started with. And while the larger county board was supportive of moving forward with this project, the local board was not. And that resulted in us really needing to look to another community to help begin to build that partnership. So really lessons learned on that front. Requiring some sort of training on harm reduction, drug-related stigma, vending machine operations for organizations that host a machine has really been essential for implementation. I think not assuming that just because someone has some cultural competence or cultural humility in one area, for example, maybe working with people living with HIV, that it extends to another area like substance use and harm reduction. Additionally, surveying the community that you serve. This is one of those key tenets of harm reduction around participant-centered services, but really asking for feedback in the multiple areas of your program, of this particular program. A great example is getting feedback around utilization. So initially, folks could have 2 smaller packs of syringes from the machine per week, and what we were finding was that, or what was found was that folks were doing sort of those 2 swipes right at the same time. So Chelsi and Rick and their team brilliantly put more syringes into a single pack so that folks wouldn't have to, utilize 2 swipes on that one visit, and were able to maximize the cost efficiency of those products. And then developing a strong and sustainable program plan, which is really essential to any success. Next slide, Chelsi. Great, thank you. And so finally, if you're inspired from this presentation today to start vending, these are a few implementation considerations that we brainstormed and looking forward to discussing more. Machine placement and locations that are convenient, accessible, and in a place to help reduce stigma. That includes the staff training at the vending machine location to ensure anyone coming into contact with folks utilizing the vending machine understands overdose reversal, the importance of first-person language, stigma reduction, and other key tenets of harm reduction. There's lots of considerations around funding and cost. So these include things like the cost of purchasing the machine, ongoing operation, the cost of products, packaging, insurance, disposal should all be really considered and budgeted and planned. Product quantity in the machine, so how often clients might be able to utilize the machine, the selection of products, should be considered, of course, with input from the folks themselves, and then some considerations on marketing and advertising. And always we encourage jurisdictions to observe local laws in terms of the implementation considerations. Those are the slides that we have prepared for today and are hoping. I saw some questions earlier in the chat, but I assume that there are more, so a really robust discussion here. And feel free, mine and Chelsi's contact information is up here. But if you're in the process of exploring vending, we're also looking to start a quarterly call to build a community of practice with the multiple agencies. As we mentioned, there are over 20 jurisdictions who are reaching out to Chelsi, particularly in COVID-19. So we're looking to begin to build that community of practice for agencies and groups across the US, since this has been established internationally, but not here. And I always like to end with, it's an honor always to present with Chelsi Cheatom and the incredible work of Track B. We've also included folks here in the acknowledgements, additional folks from Chelsi's agency, mine, and other groups across the community. We really recognize the collaborative effort that it takes to make this happen. So I'll pause there. Chelsi, there were a few questions in the chat. I don't know if we want to read those out and then really open the floor for discussion.